I was diagnosed with cancer in January 2022. They told me it was unusual cancer called cancer unknown primary, which I didn't know nothing about. I thought cancer was just cancer. The prognosis is approximately 9 months of life left. But all these new trials and clinical trials, which I got onto, quite fortunately really, has kept me now going nearly 3 years. So I've known now the tumour has shrunk, but they still cannot find the primary source of the cancer. So if they can't find that, it's quite impossible to treat, just maintain. So coming to a place like the Cancer Research Place today and talking to some of the scientists has really helped me to find out where the money can go.
Cancers of unknown primary, or CUP, are unfortunately advanced cancers at the time of diagnosis. Patients have a long diagnostic journey, and unfortunately our usual tests fail to identify where the cancer started. For patients with CUP, that means we have limited treatment options and newer therapies are out of reach.
Our research team are developing a blood test to help us overcome the challenges with the diagnosis of cancers of unknown primary. So when a cell dies, it releases DNA into the blood, and this is true for tumour cells as well. And so by taking the blood sample, this allows us to profile the tumour cells without the need for an invasive tissue biopsy. There are many features on the DNA that we can analyse, but for CUP in particular, we look at markers on the DNA that give us a postcode of where that piece of DNA has come from. So from just 2 teaspoons of blood, we can isolate the floating DNA, we can analyse these markers to get our postcode, and then you can use a computer to look against a address book full of different tumour types to identify where that DNA has come from and tell us the primary cancer.
The final stage of testing for this blood test will be putting the test into a clinical trial to see if it can benefit patients with CUP. Not only will we see if we can make a diagnosis in patients with CUP, but we'll see if treating patients based on the blood test improves their outcomes and hopefully speed up the time to treatment. This research and this blood test will give patients hope for the future.